Hello, my name is Dr. Priscilla Cabán. I am presenting my study titled A Comprehensive Care Management Approach to Reducing COPD Readmissions. This is a randomized clinical trial. Here's a brief professional bio about myself. I'm a registered nurse for 19 years. I began my nursing career with an associate's degree. I gradually earned my bachelor's, master's, and ultimately my Ph.D. in nursing. My nursing career consists of acute care, long-term, and home care nursing. In servicing the community as a home care nurse for over 17 years, I learned a tremendous amount about health disparities within our communities, and I became extremely passionate about nursing research and how the nursing practice can impact the lives of individuals facing challenges with managing their chronic diseases. I published my first research study titled The Use of Home Telemonitoring for Heart Failure Management Among Hispanics, Non-Hispanic Blacks, and Non-Hispanic Whites in the Home Healthcare Now journal. I work at UConn Health, approaching 10 years here. I am a proud graduate of UConn's Health First Nursing Research Fellowship Program. The problem. So why COPD? Chronic obstructive pulmonary disease is among the leading causes of 30-day hospital readmissions globally. Poor management of COPD results in increased hospitalization readmissions, healthcare expenditures, and increased mortality rate. Here's the background on COPD readmissions. The 30-day readmission rate for COPD patients is between 18 to 22% nationwide. The failure to effectively gain control in optimizing disease management among the COPD population has directly impacted the nation's healthcare finances. The increased rate of COPD readmissions account for $32 billion of the nation's healthcare expenditure. In an effort to gain control of this prevalent issue, in 2015, the Centers for Medicare and Medicaid Services, also known as CMS, implemented the Hospital Readmission Reduction Program, HRRP. The HRRP provides healthcare providers with incentives to take the initiative in ensuring the delivery of effective and adequate management of patients with chronic diseases, such as COPD. The HRRP added COPD to the readmission list, penalizing hospitals as much as 3% for high readmission rates. A retrospective analysis was conducted by reviewing the data collection obtained on COPD readmissions to UConn John Dempsey Hospital in 2017. This analysis revealed that in 2017, there were 99 COPD readmissions, with a 29.29% readmission rate. This readmission rate included all-cause readmissions. Also, this data revealed that 65.5% of females were readmitted, whereas male readmissions for COPD was only 34.5%. Problem identified. Prior to moving forward with the development of my study, I first identified the problem. UConn Health experiences challenges in optimizing COPD management among our patients. Additionally, our rate of COPD readmission in 2017 was higher than national average. Previous studies which examined transitional care, multidisciplinary collaboration, and care coordination management approaches revealed positive effects in reducing COPD readmissions. A previous study conducted at UConn Health Center by Dr. Jason Ryan, a cardiologist, and his team incorporated a collaborative approach as an intervention to reduce heart failure-related readmissions. In this study, the team provided one-on-one patient education at the bedside prior to the patient's discharge, as well as ensuring that their patients who were enrolled into their study had a 7-day provider follow-up appointment scheduled prior to their patient's discharge. Current Care Management Study. This is a quality improvement initiative applying a new nursing intervention. For this randomized clinical trial, the goal is to obtain a sample size of 52 by purposeful sampling. The sample will include only patients who are admitted to John Dempsey Hospital for COPD onset or COPD exacerbation. Inclusive is ICD-10 code J44.1 or J44.9. All other pulmonary diagnoses will be excluded. Intervention. This care management study mimics the heart failure approach conducted by Dr. Ryan and his team, as his study yields positive effects in reducing heart failure-related readmissions. The care management study follows a collaborative approach. Participants are randomized into two groups, care as usual group or intervention group. Participants in the intervention group will receive bedside education by myself or a trained employee or personnel. Additionally, we will ensure that participants have a 7-day follow-up appointment scheduled and ensure that the participant has adequate transportation to and from his or her appointment. My research question is, does this implementation of a new care management intervention protocol in the hospital setting reduce COPD readmissions? The hypothesis is the implementation of a new care management intervention in the hospital setting reduces COPD readmissions in the first 30 days following discharge. The data analysis plan consists of collecting prospective data of patients admitted to John Dempsey Hospital for COPD admission. ICD-10 codes J44.1 or J44.9. Each patient will receive a weekly follow-up phone call up to 30 days post-hospital discharge. We will inquire whether or not the patient was readmitted to John Dempsey Hospital or another acute care hospital within 30 days of their hospital discharge. Test the difference, a two-way ANOVA, will be carried out to test the main effects for condition and gender, and test for interactions. So, in preparing for the study, I obtained IRB approval, developed a pulmonary rehab pamphlet, educated and recruited UConn nursing students and UConn staff nurses. I also educated the medical and care coordination team regarding the study to ensure collaboration. I implemented the study in May 2019. Recruitment is ongoing. Epic electronic health record is reviewed daily to identify COPD readmissions. Patients are screened for eligibility, then approached. Each potential candidate receives a thorough explanation of the study and consents. If they agree and sign the consents, then they will be randomized into two groups using a randomizer application. The two groups are as follows: care as usual group or the control group, where they will receive no intervention, or they will be randomized into the intervention group. The intervention. The PI, which is myself, or a trained assistant, will meet with the consented participant to provide one-on-one COPD education at the bedside prior to the patient's discharge. The education covered will be the COPD booklet, how to manage chronic lung disease, COPD zones and action plan, guide to pulmonary rehab, medications, nebulizers, oxygen, and adherence to treatment plan and appointments. Additionally, we will ensure that the 7-day follow-up appointment with the patient's pulmonologist or primary care provider will be made prior to the patient's discharge. We will also ensure that the participant has transportation to and from their appointments. If transportation is an issue, then we will place a social worker consult if warranted. Pulmonary Rehab Guide. I developed this guide to provide to the patients in the intervention group. It is an additional resource tool for them to assist them, as this guide identifies post-acute care home care agencies, skilled nursing facilities, acute rehab facilities, and outpatient centers with designated pulmonary rehab programs. These are additional educational materials we provide patients who are randomized into the intervention group. Every participant will receive a weekly phone call up to 30 days post-discharge conducted by a study-trained UConn nursing student. The nursing student uses the post-discharge call template and asks a series of questions. The purpose of the call is to learn of any readmissions and learn how many days to readmit. Preliminary data. We currently have enrolled 15 participants, 8 males and 7 females, with a total of 4 readmissions. Preliminary analysis and results. I conducted a preliminary two-way ANOVA, but the sample size is too small currently for a meaningful analysis. Here is a sample plot which shows that females' estimated margin mean of readmit is greater than males. Interaction is suggested, but again, sample size is insufficient for meaningful interpretation. Acknowledgement. I'd like to send a special thank you to UConn's School of Nurses, as well as UConn's health staff nurses for your assistance. Collaboration is a vital component in reducing COPD readmissions. Together, we can implement evidence-based nursing practice that will improve chronic disease management and improve quality of life for those patients that we are caring for. Final results to come. Recruitment of study participants is ongoing. Final results to come by the end of 2021. Thank you.